There are several different surgical options for patients with cholesteatoma. It really depends on the location of the cholesteatoma and how extensive the cholesteatoma is. In general, small cholesteatomas can be taken out through the ear canal. This is called a tympanoplasty. If the cholesteatoma is directly on the other side of the eardrum, often only entry into this area through a tympanoplasty is needed. In some cases, the cholesteatoma has also entered into a space called the epitympanum. The epitympanum is above the ear, the middle ear space, and in this type of surgery, additional bone has to be removed right above this area, and this is called an adichotomy that needs to be performed. In both of these cases, the main goal is to open this area up to visualize where the cholesteatoma is, and then to resect it afterwards. When cholesteatomas grow very largely, they often can go into the mastoid bone as well, which is behind the ear, and in these cases, a mastoidectomy has to be performed. Mastoidectomies come in two major different types or varieties. The first is what's called an intact canal wall mastoidectomy. In this procedure, what we do is through an incision behind the ear, we have to access the bone behind the ear canal, and we then use a drill to enter into the space, and then we have good access into this area. In cases where the cholesteatoma is not extensive into the mastoid bone, or in cases where the mastoid bone is very large and can allow for easy visualization through this process, an intact canal wall mastoidectomy often is performed. In some cases in which the ear canal wall potentially is also damaged by the cholesteatoma, or if the cholesteatoma is on structures such as the facial nerve, which gives facial function and facial movement to the face, and the cholesteatoma cannot easily be taken off of some of these structures, then we have to do a second procedure. That second procedure is called a canal wall down mastoidectomy. This procedure is different in philosophy. Basically, what we're trying to do is open up the cholesteatoma and not to necessarily remove it in its entirety. Instead, what we're trying to do is open it up so that the cholesteatoma can be no longer trapped behind certain spaces. Also, it allows it to be cleaned and visualized in the office after the surgery is done.